We hear about a lot of sudden cardiac arrests or people dying suddenly these days. Is it something that is new? Is it something that was never there before and it is suddenly happening? My thought to it, although I don't have data, is that perhaps it has always been there. The usual rate of sudden cardiac arrest is very low in a population that is generally healthy. But because the size of the population that is generally healthy is so large, the absolute number of these events are large. And therein lies the need to do something for sudden cardiac arrest. Sudden cardiac arrest can have a number of reasons contributing to it. Heart attack or occlusion of your blood vessels suddenly is one of the reasons. What causes a sudden cardiac arrest is an event called ventricular fibrillation. Now, ventricular fibrillation is disorganized, chaotic activation of the lower chambers of your heart, commonly called the ventricles. The ventricles are responsible for pumping blood to the body, to the brain. When there is a chaotic, disorganized activation of the ventricles, there is no blood that gets pumped out. And as a result of this, people die. Now, what causes this event remains a mystery. Common reasons that we know are sudden occlusion of blood vessels, commonly called the heart attack, leading to this event. Some people may have prior heart disease with poor pumping of the heart. That makes it more prone to have this event. Some people may have genetic problems, which makes them prone to this event. But in the general population, without any apparent cardiac disease, we still do not understand why this happens. And as a result of this, it is critical that we react to such an event if it happens in front of us. And therein lies the need for what is called bystander resuscitation. If you are standing in front of a person who has collapsed suddenly, he does not respond to you, you start CPR. That is the only thing known to double the rate of survival of these patients to a hospital. And that by itself also is pretty dismal. The survival rate increases from 4% to 8% if this happens. So really, there is nothing that we can do about it other than react to it when it happens in front of us.